Good morning to one and all. Today I am presenting paper on plant latex causing plant latex euphorbacea and ocular calotropes causing ocular toxicity due to accidental exposure. Nil financial interest. Introduction: some plant with milky latex may cause ocular injuries in case of accidental contact with human eyes, and these elicit different pathogenic mechanism and different clinical manifestations, and most commonly Euphorbacea and Calotropes family plants. Euphorbacea on contact with human eyes will cause photodermatitis, conjunctivitis, mild to severe keratitis, corneal ulceration, uveitis with hypopoion, corneal scarring, miosis, and blindness. Calotropes family will cause sudden painless diminution of vision with photophobia, conjunctival congestion, mild to severe corneal edema with Descemet's folds, iridocyclitis associated with secondary glaucoma. And most of the cases in our study are treated with corticosteroid, anti-glaucoma agents, cycloplasics, hypertonic saline, and tear supplements. Objective of our study to determine the ocular toxicity due to accidental exposure to plant latex. Methodology. It was a prospective observational study. Duration was 6 months and 32 patients are included, and exclusion criteria is those who are not willing and those with pre-existing corneal pathology or opacity. Detailed history and examination of the patient was done at first presentation. After copious irrigation of the eyes, treatment was given with topical steroid, antibiotic, and artificial tears. Patient follow-up was done after 48 hours, 1 week, and 2 weeks. Result of our study: out of 32 patients, 20 were males, 12 were females. 13 patients came with exposure to Calotropes sap, and 18 patients with Euphorbacea. One patient with mango plant extract. All presented with burning and irritation of the eye. 28%, 87% were exposed while doing agricultural work, and 4 while plucking flowers from Calotropes. In our study, males found about 62.5% of the patient, and 37.5% are female patients. Almost 75% of the patient presented within 24 hours, and both eye presentation was found in 48% of the cases. 87% of the cases presented with burning sensation and pricking sensation of the eye, and 45% of the patient presented with 6/9 to 6/18 visual loss, and 29% patient presented with eyelid edema, 100% patient with conjunctival congestion, and 61% patient with corneal edema and Descemet's folds. This picture showing corneal edema and Descemet's folds. Treatment: most of the patient in our study treated with topical antibiotic and corticosteroids and tear substituents. After 2 days, corneal edema was dissipated in almost all patients of Euphorbacea and Calotropes patients, except in 5 patients. In 5 patients, corneal edema decreased at the end of 1 week, and almost all regained the vision in 1 week. Discussion: plant genus Euphorbacea is an ornamental plant. It is used for treatment of cancer, tumor, and warts from at least the time of Hippocrates. And Calotropes procera, it found in tropics of Asia, Africa, and northeast of South America, and it commonly known as Madar or Akra in India. Discussion: KF Show et al. Reported ocular injury caused by euphorbia, and sequence the initial symptoms of all patients were burning pain. Euphorbacea have caused punctate erosion, microbullae, and Descemet's folds. And in Ingrid U. Scott et al. Reported Euphorbacea sap caused punctate epitheliopathy. Patient noted immediately burning sensation and photophobia, but no visual loss. Similar observation was made, but we had observed only 1 cases with epithelial defect and erosion. Nidhi Pandey et al. Reported all patients with burning sensation and watering immediately after the accidental splashing of Calotropes latex. And Samar K. Basek reported accidental inoculation of latex of Calotropes procera in 29 eyes. 9 had iridocyclitis associated with secondary glaucoma. but we do not have any do not seen any cases with idiosaccharitis and secondary glaucoma. Sivakar et al. In their study reported they have conducted study on rat paw, and after injection of latex, calotropis produces intense inflammation, inflammatory response, and edema formation and cellular infiltration. This response was caused by presence of histamine in the latex itself, as well as the release of mast cell histamine by the latex. Conclusion of the study, our study. Common presentation were severe burning, irritation, and transient loss of vision for 2 days to 1 week. Farmers are more affected because of the work in agricultural field work. Most of the patients are treated with topical antibiotic, steroids, and lubricating eye drops. And calotropis species latex cause more ocular signs than Eupphorbiaceae species. Thank you. These are the references.
Custard apple keratitis.
It comes under Eupphorbiaceae, ma'am.
Comes under Eupphorbiaceae. So for both you have treated with topical steroids.
Yes, ma'am. Yes.
Even the custard apple keratitis.
Yes, ma'am.
My doubt is, like, in none of your cases you had secondary glaucoma, because
No,
I've
ma'am.
not seen in your medical
No,
management.
ma'am. Almost all in 1 week regained vision and cornea was clear, ma'am.
Have you checked IOP for every case?
Yes, ma'am. Every case I have checked.
Every case IOP
Yes,
was
ma'am.
normal.
No, ma'am. Those with epithelial defect were not checked, ma'am. So in our setup. Okay, ma'am. In PG time I was studied this, ma'am. At that time, other than GAT, eye care and NCT was not available. So up to 2 weeks we followed up, ma'am. Yes. At the end of 1 week, almost all patients cleared, ma'am. If yes. Okay. Yes. Yes, ma'am. Okay.